improves vascular tone, so the arteries are able to dilate, especially when you're doing aerobic exercise. Aerobic exercise works those arteries, pushes blood through the arteries. So it improves the vascular tone, so the arteries are able to dilate. But as we age, the vascular tone gets more restricted and constricted. The arteries don't dilate as well. So that's why exercise will keep the blood flowing through, which will improve the vascular tone, as well as when you take certain supplements like
We're so glad that you're watching us. I'm telling you, my husband loves bringing new news to the body of Christ. He has got some information, I guarantee you, you've never heard before. He is going to be addressing a cause that is absolutely epidemic in our country, Don.
Absolutely.
You were telling me in the car, it's frightening to hear
Well, we're talking
on.
about another choice disease, which is high blood pressure, called the silent killer, Mary. And just like diabetes and prediabetes is generally a choice disease, you see, you catch a cold, you catch the flu, but you develop these diseases by consistently making the wrong dietary and lifestyle choices, such as a lot of sugar, a lot of salt, things like that, a lot of weight gain, predisposes you to high blood pressure. So we have in this country an epidemic of high blood pressure. In fact, about 50% of adults have high blood pressure or hypertension.
50%?
50%. And that's 120 million adults with high blood pressure.
Wow.
And what's sad is 1 out of 4, or 25%, only 25% have their blood pressure under control. Wow. So it's the main cause, high blood pressure, of heart disease. And literally, when you have high blood pressure, the silent killer, there's no symptoms, see? It's slowly causing your arteries to form arterial sclerosis, which is a buildup of plaque in the walls of the artery, and atherosclerosis, which is a buildup of plaque on the surface of the arteries, so that your arteries become less flexible and your arteries become like lead pipes, and so the pressure rises and you are predisposed to all of these diseases like heart attacks and strokes and kidney disease and kidney failure and hypertensive eye disease, as well as ED. Now that gets men's attention, but all of these diseases happen when we choose to have high blood pressure. It's not monitored and it's not controlled.
Now, Don, this is happening to younger people.
Oh yes, absolutely.
People think high blood pressure, 60s, 70s, but that's not what's going on.
Well, yes, it's much higher if you're 60 and above. If you're 60 to 70, you have a greater than 50% chance of having high blood pressure right now. If you're over 70, you have a 75% risk of high blood pressure.
Wow.
As you age, you increase your risk because the arteries are literally forming plaque, and both atherosclerosis, plaque along the inside lining, and arterial sclerosis, whereas the arterial wall becomes stiff and thick and it doesn't dilate like it should. So the arteries become stiffer, so the pressure goes up. It's simple how it's working.
I hope you're going to tell us what we can do.
Oh yes, there's simple things we can do
that's awesome.
that helps us. But first, let's just kind of shed some more light on it. Hypertension is mainly due to just blood pressure that continues to rise from eating too much salt. In our diet, we have so much sodium in the diet. And sodium, and I tell people that high blood pressure is easiest to see if you can have kind of a picture of it. Just picture a garden hose. And when you constrict that garden hose, the pressure goes up in the hose. Or you put up one of those nozzles and you can really increase the pressure in the hose. Or if you turn the volume of water up at the faucet, it'll increase the pressure coming out of the hose. But if you constrict the hose and increase the water flow out of the faucet, then you can really increase the pressure. Well, that's what we're doing, figuratively speaking. When we eat a lot of salt, we are increasing the volume in our arteries, which is called increased intravascular volume, which is increasing the pressure. Now, when we are under stress, when we're stressed out, when we're running late, when we have hurry sickness, when we have excessive anxiety, panic attacks, anger, hostility, frustration, irritability, unforgiveness, trauma like PTSD. These all cause a burst of adrenaline and norepinephrine and epinephrine and cortisol to be released, which increase the intravascular tone, which constricts the arteries, causing increased blood pressure. And when you combine these factors along with weight gain, belly fat, the more belly fat we have, the higher the pressure goes. So there's lots of people with increased belly fat. They're walking around with big bellies, and those big bellies produce a chemical or a cytokine called C-reactive protein. C-reactive protein constricts the arteries. The more belly fat you have, the higher your C-reactive protein. The more C-reactive protein, the more constriction of the arteries occurs, the more high blood pressure you get. So it's directly related to the bit more belly fat. Also, insulin resistance or diabetes or pre-diabetes. High insulin levels, high blood sugar causes a dysregulation in the sodium excretion. So we end up having more sodium absorbed than excreted. It also causes a dysregulation in the renin-angiotensin system in the kidneys, causing us to absorb, again, more salt, as well as it increases sympathetic tone, causing more constriction. So that's why it's so important that we, watch our diets, watch what we're eating, make sure we get our blood pressure checked. Young, I check blood pressures on everyone. We got to know the right way to check the blood pressure. Most people, unfortunately, do it wrong, but that's why it's critical. We've got to literally start teach the people what high blood pressure is and teach them how to get it under control.
You know, one thing, Don, just from your practice and seeing your patients and hearing them, it's a cycle that I see is people are so tired and their adrenals are so depleted.
Absolutely.
And when that happens, you crave salt.
Sure.
That's where that craving for salt is, because their adrenals are exhausted. So it's kind of like this loop that people are caught in.
Absolutely right. Now, do you know the culture that has the greatest, or the race that has the greatest amount of high blood pressure?
The race?
Yeah, which race?
Probably the black community.
African Americans. African Americans are more salt sensitive.
Wow.
So just a little salt can raise their blood pressure. And a lot of them, and when you hear what foods are the highest in salt, you're going to see why. A piece of pizza has about 700 milligrams of sodium. A dill pickle has medium dill pickle, 500 milligrams of sodium. But we should only consume about a teaspoon of sodium a day, or salt a day, which is 2,300 milligrams. Too many people are taking in thousands of milligrams of sodium salt, and it makes your pressure go up. So African Americans are more salt sensitive. And other things that raise the pressure, not being physically active. When we're not physically active, it helps to, again, it improves vascular tone, so the arteries are able to dilate, especially when you're doing aerobic exercise. Aerobic exercise works those arteries, pushes blood through the arteries. So it improves the vascular tone, so the arteries are able to dilate. But as we age, the vascular tone gets more restricted and constricted. The arteries don't dilate as well. So that's why exercise will keep the blood flowing through, which will improve the vascular tone, as well as when you take certain supplements like vitamin K2. One of the most important supplements in preventing calcification in the arteries. As we age, our arteries start to calcify. After the age, especially after 60, our arteries start to calcify, and we start to decalcify our bones. It happens in men and women. And so the same thing happens when your arteries calcify. After age 60, the pressure goes up. After age 70, it goes up more. That's because your arteries are starting to calcify, both the inside of the arteries and the arterial walls, so it forms almost lead pipes. And so that's why we need to improve the vascular tone. It just so happens on the inside of the arteries is a special form of cells called endothelium that are like the Teflon coating on a skillet. But this endothelial lining becomes disrupted, so that as high blood pressure occurs, it forms little nicks and tears in that endothelial lining that's just one cell thick. So we stop getting, an endothelial lining dilates the arteries. So it becomes less active, it's not able to do the job that God intended to do. So what happens is we lose that endothelial lining, and so the pressure continues to rise. But if we can take supplements that help to improve the endothelial lining, such as beetroot extract. Mary, beetroot extract contains nitric oxide boosters. That nitric oxide is the gas released from the endothelial lining that dilates the arteries. As well as we protect it with pomegranate extract, grapeseed extract, pine bark extract, and citrulline. Citrulline is an amino acid that also produces nitric oxide.
Oh, so now do you like the palm juice?
Yeah, a little palm, but palm juice has a lot of sugar in it. So we put all of ours in a supplement called CircuZone.
Oh, okay.
And that has all those ingredients. It has the beetroot extract, 500 milligrams. It has the citrulline. It has the pomegranate extract. It has the grapeseed, and it has the pine bark extract. And then the vitamin K2, we have our Super K2 that has 200 micrograms of K2 that helps to, again, prevent that calcium buildup in those arteries. Because after age 60, we get that calcium buildup in the arteries. We start to pull calcium from the bones, and we deposit it in our arteries. And that's why the Japanese for years have been taking as a primary staple nattokinase. And nattokinase is a soybean extract that's high in K2. So they don't get the degree of early atherosclerosis that Americans do because of their high intake of vitamin K2.
Wow.
So it's interesting how all this works. Now, other things that contribute to high blood pressure. See, the majority of high blood pressure is called essential hypertension. Essential hypertension means we don't know the main cause of it. There's essential or primary hypertension and secondary hypertension that's caused from usually some problem with a glandular issue such as adrenal gland tumor such as pheochromocytoma that secretes VMAs and metanephrines, which are catecholamines that constrict the arteries, or it's due to renal vascular hypertension, which is a kidney issue where the arteries to the kidneys narrow and it causes high blood pressure, or it's due to medications such as birth control pills, prednisone or steroids or non-steroidal anti-inflammatory medicines that decrease blood flow to the kidneys. These stress the kidneys and cause high blood pressure in a lot of people over time with excessive use.
Yeah,
So,
I've heard that kidney disease is caused from high blood pressure. But,
yes, but it can
but
also...
it sounds like...
Yeah, the two will affect each other.
Okay.
So the more kidney compromised one becomes, the higher the pressure goes. And so again, high blood pressure affects the kidneys, kidney disease affects the blood pressure. So they both work off one another.
Wow.
Now so again, doctors look at high blood pressure as primary or secondary. With primary, that's 90% high blood pressure, which means they don't know the cause. But we know the triggers. The triggers are simple.
Wow.
Weight, belly fat. The more belly fat, the higher the C-reactive protein. The higher the C-reactive protein, the more vasoconstriction. The more vasoconstriction, the higher the pressure goes. And when you lose belly fat, the pressure goes down. But then we also have other triggers like too much salt, and we're going to talk about the foods highest in salt in a minute, as well as not being active enough, because activity helps move the blood flow, which helps to help the endothelium and it helps the blood flow throughout the body and keeps the vascular tone the way it should be. As well as being African American. If you're African American, you're going to be much more prone to high blood pressure.
Wow.
So important, get your blood pressure checked young, get it checked regularly, and get the right kind of cuff. We're going to teach you how to do this in just a few minutes here. Drinking too much coffee. If you drink a lot of coffee, coffee increases the adrenaline and noradrenaline, which can contribute to high blood pressure. So
how much is too much coffee?
Over 2 cups a day is too much.
Okay.
So 2 cups a day, limit it, but don't go drink your cup of coffee and have your blood pressure checked. It'll be up a little bit, okay?
Wow.
As well as not being physically active, as well as being under too much stress. It increases the sympathetic nervous system, which constricts the arteries. And another one is too much alcohol. Too much alcohol raises the blood pressure. Now, the complications of high blood pressure we see every day in my office. We see the heart attacks and the strokes. Heart disease is the #1 killer in America. Strokes are #5 cause of death in Americans, but it's the #3 cause of death in women. Why? Because women live to be longer than men. They live about 5 to 10 years longer than men. So when
Is
women,
that still true?
That's still true.
Wow.
It's still true. And so women, when they get older, their arteries start to get that lead pipe because their calcium They're taking calcium. They're not taking the vitamin K2 that regulates calcium metabolism. So calcium is being stored in the arteries, contributing to the high blood pressure.
Oh, wow.
And so
but
you see what's happening?
With the Super K2, that pulls...
It will help to decrease that calcium burden in the arteries, and it'll shuttle that calcium into the bones. So again,
I know you have me taking that every day.
Oh, you're right. Well, I take it twice a day.
Yeah.
But complicated high blood pressure causes kidney disease, like we talked about. It causes peripheral artery disease, plaque buildup in your arteries in your feet and in your hands and throughout your body. It causes dementia, vascular dementia, primarily due to cerebral vascular disease or just plaque buildup in the brain, arteries to the brain. It causes aneurysms. Aneurysms are a bulging or ballooning or weakness in the arterial wall, especially in the thoracic aorta here.
Wow.
And then the abdominal aorta here, where it balloons out kind of like a knot on a tire.
Oh, wow.
And you see that knot on a tire, but if you don't get it fixed, don't get that tire changed, it's going to blow. Well, I've had patients survive abdominal aortic aneurysms where literally it was dissecting. And they, again, it's miracle stories of patients that are Christians have had literally, they didn't know what was going on. They went to the ER, was transferred by ambulance. The doctors miss it because it's and a younger patient can have it, and yet it can be easily missed.
What is it, like a pain in that area?
It's a pain, but it can come and go as literally the blood is going through and it's bulging out, and that is about to blow. It's kind of like a tire about to blow. And so you feel this severe chest pain. But if they do an EKG and it may be normal. It can be picked up with an MRI or a CT scan, but it's easy to miss.
Oh, wow.
So that can cause immediate death when it dissects and it ruptures. So that's why it's a surgical emergency to get that thing fixed. Also, eye problems, hypertensive retinopathy, sexual dysfunction, ED. These are common problems we see due to high blood pressure. Now, what's the best way to check the blood pressure, people say? Well, the best way to check it, because that's what we need to do. We've got to, number one, find out what the pressure is, and then we've got to correct it. So the way to check it.
Do you like the machines that are in the, like, Walmarts?
Yeah, those machines are great.
They are
Yeah.
good?
First of all, the best way to check, there's a lot of people that have the finger blood pressure monitors, the wrist blood pressure monitors. These are not near as accurate as the automatic cuff style bicep, upper arm biceps monitor. It goes around the biceps. Now, when you go to your doctor, you should not have your shirt on. Take the shirt off, and it should be on bare skin. It should be 1 inch up from your elbow. It should be a blood pressure cuff that literally fits your arm, not too big, not too small. These big old guys with big arms, they got to have a larger cuff around their arm.
Does it matter right or left?
Doesn't matter. You need both, really. I like to check blood pressure in both arms.
In each arm? Okay.
Yeah, so again, what we want to do now, when you have your blood pressure checked, I will usually have my nurse put a pill under the arm. The arm needs to be the level of the heart. If it's not the level of the heart, no, if it's down here, it's not going to work. It can be off from 4 to 23 millimeters mercury off.
Wow.
So that's why it needs to be the level of your heart. You should not be keeping your arm up and letting your doctor do it. It's going to raise your blood pressure. If you hold your arm up, it's going to raise it. You need to have something under your arm, like a big old fluffy pillow.
Right, so just simply holding your arm is going to stress it. So it needs to be relaxed.
And then do not cross your legs at the knees. If you do, your pressure is going to be higher. And a lot of people are sitting there with their legs crossed. No, that'll raise your pressure up.
This is good information.
The other thing that raises your pressure when you're getting it checked is if you're talking to the nurse and y'all are chit-chatting. Well, if you talk, it's going to raise your blood pressure. Don't talk when you get your blood pressure checked.
Okay.
The other thing, don't drink coffee before you have your pressure. I have patients come in my office with a big old huge grande Starbucks with 2 or 3 shots of espresso in it. And we say, my goodness, your pressure's high. They say, well, I'm drinking this grande, cappuccino with 3 shots of espresso in it.
Oh, wow.
But that constricts your arteries, so leave the caffeine off. Leave the bacon and sausage and high sodium off your breakfast.
Okay.
Just have, or skip your breakfast, have water, or have a
fasting.
Have a green supreme food or something like that, red supreme food.
Wow.
And then don't take your blood pressure after exercising. It'll raise your pressure.
Okay.
And then it's best to measure blood pressure in both arms. Now.
Okay. This has been such good information. I know that you guys are excited. You're like, my doctor's never told me this. I didn't know this. But praise God, we're just so excited to know this. He has got so much more information.
I only got half through it.
You got halfway through. So you need to stay tuned. You need to see part 2 on dealing with your high blood pressure, because you know what? This came to my mind. We're sitting here. My people are destroyed for lack of knowledge. Do you know it's not just the knowledge of the word, which is very important. It's a knowledge what we can do to improve our health, to live long, because that is the will of God. I believe that with all of my heart. Thank you for watching, and stay tuned for part 2.